In 2003, the Lord's Resistance Army insurgency, led by Joseph Kony, had spread across most of northern Uganda. The LRA abducted, abused, and tortured northern Ugandans using tactics such as sexual and gender-based violence and forcing children to become soldiers. Victims were left with severe physical and mental health care needs that prevailed long after the LRA left the region. One of the victims was a 14-year-old girl. We will call her AR. While visiting her aunt one day, she was abducted by LRA rebels, held captive, was physically and sexually abused, and forced to harm others against her will. Luckily, AR was able to escape, and when the LRA left Uganda in the late 2000s, AR and many other Ugandans could start healing from this trauma. When I met AR, she was married and had children, but continued to suffer from her experiences. She was still plagued by nightmares about the people she harmed and experiencing psychosomatic symptoms such as headaches and stomach pain. In 2020, AR started working with HealthRight's Trust Fund for Victims project, which provides integrated physical and psychological rehabilitation for LRA victims in northern Uganda. The project connected her with professional physical and mental health support, which allowed her to finally start down the long road of recovery. My name is Emmanuel Oboy. I am a psychosocial counselor with HealthRight's Trust Fund for Victims project in Uganda, and I have been AR therapist for the last year. AR came to me after a community health worker in her village recognized her need for psychological support and connected her to our project. Our team of counselors diagnosed her with post-traumatic stress disorder and depression and worked with her to create a treatment plan, including medication and narrative exposure therapy. Upon AR's request, the case management team also came for a home visit and engaged her husband in a psychoeducation session so that he could understand and help AR manage her condition and also deal better with his own anger. When the COVID-19 lockdown caused her to develop anxiety, AR almost had a relapse, but we were able to adapt quickly and guide her through this time using first phone calls and then socially distant home visits. Today, AR has completed 1 year of treatment, and I'm happy to say that she is feeling better. Her body pain is gone, her nightmares have reduced, her relationship with her husband has improved, and says she finally feels happy.